Hey, good afternoon, Facebook family. Sandria Washington here. And we are in the middle of No Shave November. So for all the men who are observing it, you know, you're not shaving your beards, you're not cutting your hair. And of course, beards matter, but hairlines matter as well. And so joining us today to talk about hair loss, we have Dr. Yates. He is the hair loss medical doctor. And so he's got some great information, not just for the men, but also the ladies. So if you are experiencing hair loss and want to get your hair back, he is the man to talk to. So thank you so much for joining us today.
Thank you for having me. I appreciate it.
Yes, most definitely. Hair is a big topic, and your story is pretty interesting. I think our viewers will find it interesting too. So can you tell us a little bit about how you started specializing in hair loss and hair restoration?
Sure. It's a pretty quick story. Born and raised in Chicago, and I was a trauma surgeon and a cancer surgeon. And during my life, my hair just kept getting thinner and thinner. I mean, you've seen guys like, you know, LeBron James, or just your hairline moves back, back.
No shade, LeBron.
Right. So, right, not saying anything bad. This is just purely genetics. I mean, baldness is genetics, so it ran in my family. So when I was a senior in high school, my hairline started moving back, college, medical school. So by the time I was a cancer surgeon and a trauma surgeon, I was 29, but I looked 40, you know, so it kind of helped me in some ways because the patients' families thought I was more experienced than I was.
Right.
Because
right.
you know, my hairline's back here. But it bothered me. So I had a hair transplant, and it worked. And not that I didn't think it was going to work, but I just didn't know it was going to work so well. And it really changed my life. So after that happened, I dedicated my life basically to hair transplantation, and medical remedies for growing your hair back. That's basically my story.
Wow, wow. And we'll see if we can find a before and after picture for you. If we can't cast it for you guys, we'll put it in the comments, but definitely a phenomenal transformation.
Well, thanks.
No
well,
shade
sure,
to you.
Well, I'm sure if you can't find one, my friends who are watching
Right.
will definitely send some, because they used to tease me all the time.
Right, right. So I know you mentioned genetics. Can you talk a little bit more about why hair loss commonly tends to happen, and is it different for men and women?
Sure. Good question. 95% of all hair loss is purely genetic. And so a lot of people will say, well, is it from your mother's side or from your father's side? Well, we know for sure now it's from both sides. So if you're losing your hair and you're in that 95%, it could be from your mother's side or your father's side. Now, when we talk specifically, say, about African American patients, it gets a little trickier, especially in women, because sometimes we'll lose hair in the sides, which is called traction alopecia, and the hairline will move back, called traction alopecia, or something even worse called scarring alopecia, where you get kind of a bald spot in the middle. That's kind of felt to be genetic, but also felt to be from styling your hair, like wearing braids too tight, maybe relaxers, just putting products on your hair that aren't good, that destroys the hair follicle.
And so for many of the patients that you see, what are they primarily coming in for?
Okay. One or two things. A lot of patients who've already experienced a lot of hair damage will come in and they've seen either our commercials or know a patient we've done, and they say, Dr. Yates, I don't want to waste any time. I just want you to transplant hair. And transplanting hair is like basically like farming, moving a crop of your own hair from kind of the back of your head to the front of your hair. And then there's some patients who come in, their hair is thinning, and they just don't want to lose their hair, and they'll say, what can we do? So we'll see, you know, either people who want the surgery or people who say, well, I really don't want the surgery. I want you to do everything you can, just stop short of the surgery.
And then what actually happens during the surgery, and how long is that process?
That's a great question. It's kind of, I explain to the patients, it's kind of like going to the dentist.
Okay.
It's done under local anesthesia. Of course, we have to numb your scalp or you would feel everything we do. But the basis of it is the hair on the back and the sides is better quality hair than the hair that's on the top and up here to the back, toward here. So we thin this hair out around here and plant it up here. And it's permanent. It will not fall out. So I know we're scrolling on some pictures behind us, but what it's showing is that the thinner areas, we've taken hair from the thicker areas, strand by strand, just like farming, thinking of like pulling out a plant in the backyard and putting that same plant in the front yard. It's a healthy plant and it will grow. So that's basically what a hair transplant does. Now the time frame people come in at 8 in the morning and we're done 3, 4 in the afternoon.
Wow.
But it's not as bad as you think, because they're sitting up just like we are now. We have a big screen TV.
Right.
They
So
watch
they're chilling, they're hanging out.
Pretty much. They're on the computer doing their thing.
Still
whatever.
can work.
Still can work. They can put on their beats. They can do whatever they want to do, as long as they don't move their head. You know, and then they have catered lunch. So, you know, we take a break at lunchtime so they can eat. You know, they can order from wherever they want in Chicago. We could care less, and it gets catered in, and they eat, and their loved one, if they're there, comes and eats with them.
Wow. And you said this hair does not fall out. So does it not, I guess, it's not subject to the same kind of aging as just your regular hair?
You're almost a doctor. I don't know if you've been studying for this or not, but that's one of the best questions ever, because if you have genetic hair loss, the hair that's on the sides, like we call it, like people call it the George Jefferson look, or the bozo look, that hair is different genetically from the hair that's up here. Because people will say, well, if you take some of this hair, the George Jefferson hair, and plant it up here, why does it stay? Because it fell out up here anyway.
Right.
So that would assume that something's wrong with your scalp. But it's the real problem is, say the George Jefferson hair is immune to these hormones that makes the hair thin up top. So you're born with two different types of hair. Hair that's much stronger, that can fight away these balding hormones that happen, and hair that's much thinner, that the balding hormones will work on and thin over time.
Interesting.
And that's kind of true for men and women. More true for men than women, but we believe it's also true for women as well.
And by the time patients come to see you, have they kind of waited a long time before making this step to actually seek a medical treatment, or do you find people are coming in, you know, right away? Because it would seem like people would be very hesitant, you know, like they've lived with this embarrassment or whatever the situation may be, and they just don't know where to turn.
Sure. And that's kind of a yes or no. We have some people that have more hair than I've seen in my life come in. They try to show me a spot. I have no clue what they're talking about. And then there are people, for various reasons, embarrassment or just didn't know what to do, you know, have waited till, you know, it's kind of, you know, not a good situation. And we see everything in between. But the best time to come in is when you notice that your hair is starting to break off or thin or just look thinner, because we know it takes a hair loss of at least 30 to 40% of what you normally had before your eye can tell that you're losing hair.
So by the time you see it, it's already been.
So by the time, like when I saw I was losing hair, like in my early 20s, I'd already lost 30% of what was already there for my eye to tell me, hey, you're losing hair. That's a lot of hair. And we don't grow any more hair. I mean, you don't get any more hair follicles. When you're born with X amount of hair follicles. That's it. You don't get any more.
Wow.
So if you drop down 30% of what you're given, that's a huge drop.
That's it. And so how do you stop, or how do you slow down hair loss? So people who've noticed it fairly early on, what are some of the things that you do to help slow down that process?
Okay, good question. Let's start with, say, like a big part of my practice is African American females that I see all the time. How do you stop the process? So the main things that you want to do is, if you're noticing that you're losing hair in the temples and you're braiding or relaxing, you have to stop that immediately. Or if you're wearing you know, a piece or a sew-in on the sides, you have to stop it, even though for some time it might look worse and your friends might say, hey, where'd your hair go? Because if you keep doing what you're doing, you're destroying the hair follicle and the hair will not grow back. That's number one. The other things you can do, there's some things over the counter called Rogaine. I don't know if you heard of minoxidil, Rogaine. That's an easy treatment for people that are starting to thin in different areas, especially from traction alopecia, to help revive and restart the hair follicles to start to regrow, things like that. But the main things are whatever you're doing, like the hairstyling, the relaxing, those seem to be the things that you have to stop doing. You know, immediately. You know, usually it's the other way around, because as they start to thin, they'll say, oh, my hair looks thinner. So what do? They go back to their stylist and they put more twists, more hair in, and it gets worse and worse and worse. At some point, you just have to cut your losses, say, I can't do this anymore for the time being, and start treatment either with Rogaine, There's something called PRP. Have you ever heard of that? We were just talking
Haven't
about
heard of that. Okay.
PRP is platelet-rich plasma.
Okay.
And it's a big deal. A lot of sports doctors use it where in your bloodstream, everybody has platelets. Platelets help your blood clot and also help you heal. So we draw blood from the patient, take out these platelets and stimulate these growth factors and inject it into their scalp. So it's like super hair fertilizer. Goes right to the hair follicle, stimulates that hair to get thicker again and not fall out.
Wow.
So we do a lot of platelet-rich plasma in African American women. We do the Rogaine, and then we do laser treatments. There's something called red light, which is a laser, which doesn't hurt, because a lot of people, when you say laser, they're like, I'm not going to put that on my head.
Right.
Right, you know.
But I want to avoid lasers.
Right. I want anything but the laser, but trust me, the laser's not what you think. It's a cool laser, meaning it's not hot, and it's red light, and it stimulates the hair follicle, again, to get thicker and regrow that hair.
And that's interesting to me because typically when I think of laser and hair, I think of laser hair removal. So you're trying to get rid of the hair, but you can actually use a laser to help grow
True.
hair.
Very true.
I'm learning so much today, y'all.
I know.
So, and I think I know the answer to this next question,
Okay.
but let's say you have a transplant or some type of surgical procedure to regrow your hair. Can a woman, or is it advised for a woman to, if she does like a nice hair weave or she likes her braids, is that normally encouraged for her? After she's had the transplant, can she go back to those styles?
She can, but everything in moderation. You know, when we transplant somebody's hair, we want you to be all you can be, and you know, however you want to wear your hair, do it. But we don't want anyone to be foolhardy and return, you know, like they did in the beginning.
Right.
So usually it's some compromise. You know, sure, you can do whatever you want to do.
Is counseling a part of the process, maybe even beforehand? Because I'm assuming, you know, hair loss, there's a lot of emotional issues that are tied to it. Is there a counseling component?
Yes. In our practice, we call it a patient educator. That's the first person that they will see even before they meet me to learn all the facts about hair loss. Because there's so many myths about just use this shampoo, use coconut oil, put a watermelon.
Don't get started on the coconut oil.
Put a watermelon on your head.
Right.
I saw a commercial over the weekend, an infomercial. I think they're putting mango juice on their head or something like that. So there's so much information out there, and how are you really going to know what's true or not true?
Right.
So we go through everything, like the things we're talking about now. When a person comes in, from the emotional, the scientific, and every treatment option available with hair. So we can kind of put you on the right track, because the internet, if you type up hair loss, you're going to find so many things. How are you going to know what's right and what's not right, or what we consider right, you know?
Right.
So yes, we do have a counseling/education component, because if you don't understand it, you'll never be able to make the right choice.
Right.
Never, you know.
What's been the most amazing transformation story or feedback that you've gotten from a patient? Because this is really life-changing. Like when I see these before and afters, you know, of
Well,
course.
that's a good one there, lowering a hairline. I would say it's so many that I'd say the biggest ones are from people who just got divorced, you know, men and women, that have had lack of confidence. And we do the hair, and they gain their confidence back, and you can see it when they walk in. They have a different strut just in their eyes. They feel differently, and they've, you know, gotten remarried, or people who feel like they were being pushed out of the job because they look old. You know, because everybody now, everything's visual. You know, people make up when they look at you, and you know, because your mind's a computer, they make up their mind what they think. So the world's so visual. So a lot of people have felt, well, I've kept my job because you kept my hairline, you know, because everybody's in shape now, but, you know, they have to have somebody help them with their hair. They can't do that on their own, you know. So we have millions of stories, and people who send us wedding pictures and said they never would have gotten this woman, or vice versa, which really isn't true, because they're still the same person.
Right.
But it just boosted their confidence to be able to talk to that person, you know. So many stories.
Life-changing,
Yes,
life-changing.
life-changing.
Well, I want to see if you guys have some questions, or comments for Dr. Yates.
A lot of folks would like to know what's the cost.
What's the cost?
The cost.
$1 million question.
Well, I always tell people it's like, buying gas. If you need a little bit of gas, it's this, a lot of gas, and we charge per follicle. The average, like of the pictures you've seen in the back, the average cost will range anywhere from like $5,000 to around $8,000. And it seems expensive, and it is expensive, but a lot goes into that. But the hair that is put up there is permanent, so it's not like you're worrying, is this hair going to fall out? It's not going to fall out. There's no special shampoo. There's no special anything you have to do once that hair is put up there.
Okay. Is there any type of maintenance afterwards? Like, do you need to come back for any extra procedure?
Extra things?
Or is it kind of, you
one and done?
Yeah.
Usually it's not one and done because we transplant people and everybody gets greedy, including myself. And you always want to do more hair and make it thicker, lower your hairline. I wish I had all my pictures, but of course I've gotten greedy and lowered my hairline through the years. So it could be one and done, but it never is because it's just like, if you're giving people money, they come back and they want more, But so most people have more than one procedure over time. There's no special regimen they have to do after it. But if their hair was thinning anyway, we do try to keep them on things like the Rogaine, or do the PRP or the laser, or if they're a man, there's medicine that you can take to slow down the thinning called Alopecia. We try to keep them on something like that.
Okay.
Yes.
Awesome.
Any tips for women with male pattern hair loss?
Yeah. Women with male pattern hair loss is pretty common, especially as women reach menopause, because the male hormones start to rise. But the tricks would be, again, to use Rogaine. And of course, they have to check with their doctor first because I'd have to examine them to get a diagnosis first. Rogaine, you can use the laser therapy or PRP, and more importantly, before we start diving into hair loss, we'd want to do a physical examination to make sure that everything else was okay. Because the things we didn't talk about that go into that education session is that there are a lot of disease processes that cause hair loss. There are a lot of medications that cause hair loss. And stress can cause temporary hair loss, but stress will never make you go bald and stay bald. Like a lot of people think, like, say even when I was a doctor, I am a doctor, but when I was a balder doctor, they would say, like, here's my picture there. That's kind of blurry. I was 29 there, and my hairline got even worse before I transplanted it. But they would just say, oh, you're just under stress. All doctors are bald.
Right.
That's not true because there are plenty of doctors that are not bald. There are a lot that are, but it's all genetics. It has nothing to do per se with stress.
Wow. For people watching, how can they get thicker hair?
So thicker hair.
How can they get thicker hair? Well, it all depends on, again, without examining somebody why your hair is thin. But there are a lot of products on the market that can thicken the hair, like volume. Look for shampoos that, are sulfate-free that are volume enhancers because they'll make the hair shaft appear thicker. But if your hair is thinning for a medical reason, then you need to see a medical professional. That's what I would say. It's a little trickier, and I hope you didn't think the answer was flippant, but it's a little trickier than just putting some grease on your hair and making your hair thicker.
How big of a role does nutrition play in hair loss, hair growth?
Very good again.
Trying to get you guys all the answers.
Nutrition is a big factor. It's not as big as everybody says. Like every patient I know, when they come to see me, they're on biotin. Biotin is a B vitamin. So everybody's always on like a bazillion grams of biotin, which you don't need to be. And nutrition plays a big part, and we know that because people who are on crash diets, before I did this, I did weight loss surgery. So the people that we would do the weight loss surgery, when they would drop weight, like on these diets and crash diets so quickly, their hair would get thin and stay thin. And that's usually from protein malnutrition, meaning that their protein levels, they don't take enough protein in, or sometimes even like biotins or vitamin A or D. So we know nutrition plays a big role, but in normal people, say like us, that keep a normal weight and don't do crash dieting or anything ridiculous, our diet is sufficient enough to grow our hair. So a lot of people who are on all these vitamins that say they don't eat gluten, they don't do this, they don't do that, that doesn't have much bearing on their hair.
How did biotin become kind of the go-to hair growth
Vitamin?
Yeah.
Good. because it's easy and it's cheap, and you do need biotin to have strong hair. But we get plenty biotin every time we eat green leafy vegetables, that's in some breads. So it's very hard to find somebody in the United States with a pure biotin deficiency. Like if you drew all our blood in this room and across the street, I don't think we'd find one person with the biotin deficiency.
Wow. So eat your leafy greens and you can
skip
the supplement.
Right, and protein. I mean, you have to
Yeah.
take in protein because this hair on the top of your head is pretty much all protein. Keratin. Keratin is a protein.
Gotcha.
Can you speak on alopecia and just to people who lost their hair from it?
Well, it's a good question. Alopecia is just a fancy word. Alopecia means loss of hair. It means balding. So everything we've been talking about this far is alopecia. So the treatment of alopecia depends on why you have lost your hair. So the word alopecia is just fancy for you've lost your hair. So a man that has a bald spot here, that's alopecia. A woman that's lost their hair in here or here, that's alopecia. The question then becomes, what kind of alopecia do you have? Do you have male pattern baldness, that alopecia? Do you have something called alopecia areata? That's when people get these patches, you know, like you see it in kids a lot, where their hair is patchy. That's a totally different can of worms with a totally different treatment. So it all depends on why you have alopecia.
A shout out from Kat. She said, I had a procedure done by Dr. Yates, the best decision of my life.
Wow.
Well, thank you.
Where can folks find you, your surgery? A lot of people say they want the surgery.
Yeah, where's your office? Where can we find you online?
Yeah, well, we have a YouTube channel, Dr. Yates, #1. I'm in Chicago, so we're in the middle of the United States, so we have people fly in from coast to coast, all countries, all the time. We do one procedure a day, and you can go under DrYatesHealthScience.com, DrYatesHairScience.com as well, or you can just go under Dr. Yates MD. We have a YouTube channel with like 1 million videos on patients and how we do it, and just what we're talking about today. We've covered a lot today.
Yeah,
I mean, we've made YouTube videos, hundreds of these things, just covering what we've done. But we're in Chicago, so if you can remember, Dr. Yates Chicago, and just Google that, I'll pop up.
On your YouTube channel, do you show like some of the actual surgery?
Yes.
Oh my God.
I'm
going to YouTube after this.
It's really not that bad.
Wow.
I mean, yeah, a little bleeding, but nothing terrible.
Nothing major.
Nothing major, no.
Wow.
Two more questions. First question is, can you add hair to scarring?
Okay, can I add hair to scars? Like scars where? Did they say where? Okay, we'll just take it wherever. The answer is yes, yes, and yes. If you have a scar, like say you had some surgery or you got hit in the head with a baseball bat when you were young, or you had radiation from a cancer treatment, or you had a car accident with a cut through your eyebrow, yes, we can add hair to any scar you have on your body and have the hair grow back. Or a lot of people with a cleft lip, come in, these are men now, and then we'll, put a mustache here or something like that.
Wow.
But we can add hair to scars, yes.
Last question. When patients get implants, can they wear wigs during the process?
Okay, yes, and that'll lead me to, say something I didn't say. When we do the hair transplant, it's a lot like farming. We put the hair in, and it takes about 4 to 6 months for that hair to start to grow. It takes a full year before you see the benefit of the transplant. Okay. So it's not an immediate thing.
Okay.
So I didn't want to, that's very important, because it's not like, you sit there and we do it and you go home and everybody's high-fiving and it's on, and you go to the club and you're doing your thing.
Right.
It's not like that. So a lot of people will wear their wig in the meantime before that hair grows out, and the wig will not stop the hair from growing.
That's awesome.
And that brings me to mention one more thing. We do a lot of micropigmentation. That's immediate. That's usually some men and women who want to create, like mainly more in men, who want just that 5 o'clock shadow appearance on their scalp. Like say somebody like, everybody knows what Michael Jordan looks like now, how bald he is. If we wanted to create like a hairline like Vin Diesel, just like 5 o'clock shadow all the way around on his head, we do that all the time. Now that's immediate. Wow. So he can come in looking like, he did, but when he left that night, he would have a hairline and he could go to the club and rock it.
Wow.
And we have some pictures of that we've been scrolling through as well.
Wow.
So
and you can definitely see more pictures on the website.
yeah, and we
as
do
well.
that in female patients as well with traction that don't have enough hair to transplant or for some reason don't want to transplant. We can do micropigmentation, and it looks great. You will not be able to tell. Like a lot of people are doing it now. I guess I see on TV, on a lot of the sports channels, I'll see, it looks like somebody took a Sharpie and drew in. Ours doesn't look like that.
I was going to say, I'm like, can you tell? Well, you can probably
Oh, I
tell
can
because
tell.
you're the expert, but
We
the
could go-
average eye
No.
can't tell. Okay.
If you're doing it correctly, you know, I shouldn't be able to tell really.
Okay.
You know, but if you watch TV, we could turn on any channel right now, and I could point out 5 people that have, you know, doing some Sharpieing and this and that.
Ooh, no Sharpie.
All right.
Does insurance cover the cost of your surgery?
Unfortunately not, because insurance companies could care less whether you, me, or even you have hair. They don't care, so they're more worried about our heart and our kidneys. But they should cover it because it causes a lot of emotional distress, and I mean, the change once people get their hair back is just amazing. You know, I think they should.
Can you speak on lupus of the scalp?
Yes, lupus of the scalp. A lot of people have what's called autoimmune problems, and that consists of like lupus, scleroderma, fibromyalgia, all this category, and it's getting bigger in you know, polymyositis, anything with the word itis in the back. There's a whole lot of disease processes that affect the hair. Lupus is one of those, and we see a lot of patients with lupus that lose their hair, and they get scarring, like patches of scarring where the lupus has actually destroyed the hair follicles. So we'll wait until that scarring has reached its maximum and doesn't do any more, and then we'll transplant them or treat them non-medically to try to grow as much hair as we can back. So we see a lot of lupus patients and patients with autoimmune disease all the time. It's getting bigger and bigger and bigger. That group of patients is growing. Yes.
Last question. Assuming a patient gets a hair transplant, but their other hairs are gray, does the new hair come in gray or black?
Gray. That's a good one.
Yeah, the hair comes in whatever color that it was where we take it from, that's where it grows the same color. Once your hair turns gray, it can't turn back black organically or whatever color it was, because gray hair just means that the hair shaft isn't taking up the ink or the melanin that it usually does. So once that hair shaft says no more melanin is going up the tree, wherever we put it, no more melanin is going up the tree. It's going to be black. I mean, gray.
Follow-up question. Somebody else asked. I wasn't going to ask it, but now, yeah. Can you get hair from a donor?
You can, but unless you're an identical twin, it wouldn't work. Say, when we used to do kidney transplants, people can get kidneys from people that are similar genetically. But to prevent rejection of that kidney, the person who gets the kidney has to take a whole lot of medicine to keep that kidney alive. Nobody's going to pay for that with a hair transplant, for you to be on a stack of medicine to keep your hair. Like, say if you or, you know, you and my sister, now you and me were a good match with hair, and you gave her some of your hair, and for that hair to stay, she'd have to take a whole lot of medicine that nobody's going to pay for.
Wow.
Where insurance covers that if it's a kidney or something.
So it really is. I mean, you're growing your own hair,
Right.
essentially. Yeah.
Right. So it probably would work, but nobody's done it because it's too expensive.
Gotcha.
So the only way you can really get a hair transplant is we get it from you.
Gotcha. Well, this has been super informative. I want to thank you so much for coming in.
No, well, thank you.
Sharing with us. Again, Dr. Yates is here in Chicago, but you can find all of his information online. He's on YouTube. Google him. We also have the playback of this video, so definitely share it with your friends and family, and we will see you next time, Facebook.
Yeah, thank you again.
Are we clear?
Well, that was a good show.